Hello, my name is Dylan Crail, and I'm a student physical therapist assistant at CBD College, and I will be conducting your education on strategies for proper skincare of burn wounds. First, let's talk about soap and bathing. So we want to use fragrance-free soap. The fragrances, rather the compounds that create the fragrances in soap, can cause dryness of the skin or maybe even an allergic reaction. Either way, we can cut that out by just getting a fragrance-free soap, and that can treat the wound more optimally. Also, we want to bathe with lukewarm water. Too cold, it might, aggravate the wound, as your wound is very sensitive and healing. Also, we don't want it to get too hot, as this can create swelling in the wound through vasodilation, which is more blood rushing into the wound due to the hot water on the surface of the skin. As far as creams to use, we also want to stick with fragrance-free for the reasons as mentioned above. Also, green flags as far as labeling is you want to look for moisturizing cream to keep the wound from getting dry. We want a certain type of moisturization for the wound in its healing. And also, we want hypoallergenic. Hypoallergenic means no allergies or the reduction of a chance of an allergic reaction, which could complicate the wound healing. We want to rub this gently into the skin. We don't want to shear too hard and risk opening up the wound or just causing further swelling or irritation after it's been cleaned. If we're rubbing this lotion in and potentially rubbing in germs, that can increase the chance of a reaction or an infection. We also want to apply it as needed, no more, no less. Oversaturating it with moisturizing cream can create too much moisture, and we want to find an in-between. Think of it as like drinking water. You want to sip throughout the day. You don't want to take 1 or 2 chugs throughout the day. That's not the best way to hydrate. Everything in moderation. As far as sunscreen, we want to use 30 SPF, which is just the right amount of protection. You can go a little higher, but no less than 30 SPF. We want to protect our skin against UV rays, and also fragrance-free. I hope you're noticing a trend by now. We also want to make sure we cover the wound, or with any kind of fabric. Even though we do have sunscreen, an extra layer of fabric or clothing would help, as the UV rays can even attack healthy skin. More so if you're light complexion and have less melanin to protect the skin against these UV rays. As far as open wound protocol, we want to gently clean the wound, again, so we don't over shear or over irritate the wound as it's healing. And we also don't want infection. Now, what are signs of infection? That would be more discharge than we're accustomed to seeing during the healing process, a regression, if you will, or more swelling, more redness. If you notice any of these things, you want to contact the MD right away, or your general health care provider. As far as dressing and undressing the wound for open wound protocol, you want to follow the doctor's orders, as your wound, yourself, as well as the doctor's methods are all unique to the situation. So one size doesn't fit all in this case. Just follow the doctor's orders. As far as avoiding skin irritation, we want to do this by using loose clothing first of all. Tight clothing can constrict the wound. It can also cause shearing. We also want to make sure we use cotton clothing or breathable clothing. I just use cotton as a good example, versus what's a bad example? Leather. That traps in the moisture, that creates more moisture than we want, throwing off the equilibrium that I mentioned earlier. We want not too much moisture, not too much dryness. We want that sweet spot in between, and breathable clothing does that. We also want to use MD recommended or given wraps. We don't want to use, or bandages. We don't want to use the Band-Aid type bandages that can stick to the wound, possibly reopen it, or just cause further irritation that can lead to infection or just delayed wound healing in general. If you notice any redness or swelling from the bandages given to you, discontinue that and contact your healthcare provider immediately. Now, what if you have itchy skin? Don't scratch it, even though that is kind of what we seem to go to. We don't want to do that. That can open up the wound, delay healing, and further cause possible infection. Now, what can we do? We gently pat it. That's the best way to kind of calm down the symptoms. And we can also ask the doctor about potential anti-itch creams or certain remedies of that nature that can help slow down that process, slow down the itching.